Pulse Talk, bringing insights into health and wellness with your hosts, Christine and Alex.
Welcome to the Deep Dive. You know, it's funny how easy it is to just push health stuff aside until it, well, hits close to home. Today, we're looking into something that's actually way more common and frankly more painful than people often think. Shingles. Yeah, our goal here is simple. Break down what shingles actually is, figure out who's really at risk, talk about the symptoms, and maybe most importantly, how you can prevent it. We've pulled together insights from some great sources, including articles from Alpro Pharmacy. They really focus on making health info easy to grasp.
Absolutely. And think of this this deep dive as a chance to get that key info quickly. It could really help protect you or maybe someone you know. It's about, well, being prepared.
Okay, so let's unpack this. Shingles. Most people think painful rash, right? But what's actually going on underneath? And how does it link back to, chickenpox?
Right. So what's really fascinating here, and honestly it surprises a lot of people, is that shingles is caused by the varicella-zoster virus, VZV. And yes, that's the exact same virus that gives you chickenpox. After chickenpox, the virus doesn't just vanish. No, it sort of retreats. It lies dormant, inactive inside your nerve cells
For years.
and sometimes for decades. And then later in life, something can trigger it to reactivate, and that's when you get shingles. It's very much a viral thing, not like eczema or other skin conditions which have different causes.
Wow. Okay, so a childhood bug just waiting.
Yeah.
That's quite something. If it's hiding out in anyone who's had chickenpox, then who's most likely to see it actually wake up?
Yeah.
Is there a main group we should know about?
Yes, there definitely is. The biggest risk factor is age, specifically adults aged 50 and older. Their risk just goes up significantly.
50 and up. Yeah.
But it's not just age. Anyone with a weakened immune system is also more vulnerable.
Wow.
That could be from, the aging process itself, but also chronic stress, certain illnesses, or medications that suppress the immune system.
Makes sense.
And here's something really crucial, maybe the most important point from our sources. The real danger often isn't just the rash itself, painful as it is. It's a potential complication called Postherpetic neuralgia, PHN.
PHN. What's that exactly?
It's this awful, lingering nerve pain.
Yeah.
It can be burning, stabbing, aching, and it can stick around for months, sometimes even years after the shingles rash is gone. It can seriously impact your quality of life.
Years. That sounds debilitating.
It really can be. And the stats are quite sobering. At age 50, the risk of getting PHN after shingles is around maybe 18%. But by age 80, that risk jumps to about 33%. A third of people. Imagine dealing with that chronic pain.
That really puts it into perspective.
Yeah.
Okay, so what are the symptoms we should be watching for? What does shingles actually look like? And are there myths? Like, does it really wrap around your body?
Good questions. Often the very first sign isn't the rash. It's actually pain or maybe itching or tingling in one specific area. That can happen several days before any blisters show up.
Ah, okay, like a warning sign.
Exactly. Then the rash appears typically blisters, quite painful, and usually just on one side of the body or face. It follows the path of a specific nerve.
Just one side. So the myth about it wrapping around.
Yeah, that myth about it wrapping fully around the body and being fatal, that's just not true. It rarely, if ever, goes all the way around. And while shingles is intensely painful and can lead to serious issues like PHN, it's very rarely fatal. But you absolutely shouldn't ignore it because of the pain and those potential long-term complications.
Right. So given how nasty this can be, I guess the big question everyone's asking now is, can we stop it? Is there anything we can actually do to prevent shingles in the first place?
Yes, absolutely. And this is where modern medicine offers a really powerful tool: prevention. The shingles vaccine is vital here. It can significantly prevent you from getting shingles altogether and, crucially, also prevent those severe complications like PHN.
Okay, prevention is key. And these vaccines, the newer ones like Shingrix, are they really that good?
They are remarkably effective. The data we looked at shows Shingrix is over 90% effective at preventing shingles. And perhaps even more importantly, it dramatically cuts down the risk of developing that long-lasting nerve pain, PHN.
Over 90%. That's huge.
It really is. It offers long-term protection, too. Now, you might get some mild side effects, maybe a sore arm, feeling a bit tired for a day or so. But honestly, that's minor compared to actually getting shingles.
Definitely. So who should be getting this vaccine?
Well, the recommendation from the CDC and public health bodies generally is for all adults 50 and older to get the Shingrix vaccine. That's the current advice.
Even if you think you've had shingles before? Or had the older vaccine?
Yes, even then. The recommendation holds. It's a 2-dose vaccine, and it's considered the best way to protect yourself right now.
Okay, good to know. And this is where places like pharmacies come in, right? Our sources mentioned Alpro pharmacy playing a role.
Precisely. Community pharmacies like Alpro are becoming really important hubs for this kind of preventative health. They offer accessible information, which is great. Plus, many offer services like pharmacist consultations. Alpro even has an e-pharmacy service for that. And of course, they provide the vaccinations themselves. They also run public education campaigns. It's all about strengthening community health, protecting those who are most vulnerable.
So it makes getting that advice and the vaccine potentially much easier.
Exactly. It's about accessibility.
Okay, so wrapping this up,
Mhm.
what's the main takeaway for everyone listening?
I think the core message is, yes, shingles is serious, it's painful, and the complications like PHN are really tough. But the good news, the really positive message, is that it's largely preventable.
Through vaccination.
Through vaccination, primarily. So the advice is really to be proactive. Think about your own risk, maybe chat with family members, especially older relatives, and definitely talk to your pharmacist or your doctor about shingles protection.
Use those resources available.
Absolutely. Places like Alpro Pharmacy, your local GP, they're there to help with consultations and getting the vaccine. Don't hesitate to ask.
So maybe the final thought for you listening is this. What proactive step will you take today?